It's the fifth time I am in this conference, and I experienced the evolution. And what is very positive from my point of view is that this conference is promoting more research on the topic of hydration. So every year we are coming here expecting to have the new data, and this year we had especially data on fluid intake in one hand and vasopressin or effects of vasopressin in different metabolic pathways.
5 years ago, the idea that hydration was important was ignored by a lot of scientists because they said, well, the kidneys can concentrate the urine adequately, so it doesn't really matter if you drink too little or too much water. And nowadays, the science has really progressed, and we realize that low water intake actually is an important risk factor for kidney disease. So it is impacting my practice. So when I see patients, I'm encouraging them to drink more water as there's more and more evidence that higher water intakes can slow kidney disease.
The scientific conference of this year is one of the best because there is a lot of new speakers of a very good quality. I can speak that over the years. The first one was in 2009, and I have noticed, you see, the evolution and the quality of the speaker, of the organization of this conference. So I think it's one of the best places to learn all the aspects of hydration-related questions.
The important part of this year's conference is that it has started combining all the aspects of hydration. So we started this morning by talking about the prevalence of hydration around the world in many different countries. And then we move on into pathologies linked with low drinking, like metabolic syndrome, dysregulation of glucose, and chronic kidney disease. And then at the end, we talk about the importance of different programs that we can use to intervene and change hydration habits and make people drink more water.
There is nowhere in the world where we have a one-day conference with those topics. This is the most outstanding hydration conference on earth, and it's remarkable to attend this conference. I have attended 7 meetings consecutively, and I have seen changes across the years. The first change involves the quality of the science, and the second change involves the quantity of the science, and the third change involves the publications, which is the way that scientists communicate. And all of these have grown.
Today indeed was a milestone in the domain of fluid intake. We announced a series of publications reporting on fluid intake data, collecting a huge set collected in 13 countries in 3 continents. So it was very important to make this data available to all hydrationists working in this domain. And it's with the help of a collaboration of many experts in the field. So LIC-IN 7 refers to this whole process, delivering high quality fluid intake data.
I find it very inspiring that in all the jaw communities in the Netherlands, drinking water is such a very attractive theme, and that they get very good results, all with just making drinking water very attractive. So I'm happy with that, yes. I enjoyed very much the integrations with the scientists and bring them the day-to-day practice. In my day-to-day practice, I observe a change every day, where in primary schools, children drink more water, and that's very inspiring.
The overall impression of this meeting, it is unique, one of its kind. As a kidney doctor and nephrologist, we're very interested in the effect of hydration for kidney health. And I think this is an opportunity for us to expand our own research platform, but integrate it into really world knowledge.
It was really excellent and a good mixture of different flavors. Particularly, of course, on the importance of water intake.
To me, hydration for health conference is one of the best conferences I've ever attended. So I think the scientific issue is very good and focused on hydration, and gave me a lot of inspiration on how hydration can actually influence your health, your kidney health and metabolic syndrome and other non-communicable diseases. So I'm happy to be here.
I think that more and more in the future we need to make sure that we help people to have a healthier hydration, a healthier diet, so that they prevent health issues in their lives. If I were to define the event in a few words, I would say continuity. And if I were to define the importance of healthier hydration in a few words, I would say prevention and long-term thinking.